Well, ladies and gentlemen, here I am with the illustrious Dr. Jon Harmon, who's been gracious enough to join us today. Dr. Harmon, thank you so much for taking time to do this with us.
Thank you, Don. I'm excited to share this information with you and your team.
Uh, you know, I can't help but wonder, and one of the things I want to get across to people, I was reading the back of your book here, and you graduated from the College of Chiropractic in 1989. In 2016, you founded ClearMind. You're a certified quantitative EEG specialist and neurofeedback. You also do lectures for a laser producing company. And as if you weren't busy enough on those fronts, you took the time to author a book called How to Reverse Aging and have become, I'll make the statement, an expert on GHK-cu, the copper peptides.
Yeah, it's been interesting how I was really focused in my early days of elevating my own copper peptide. I wanted everybody to know what that is and how it works. So I prepared some three different PowerPoint presentations over the years to show everybody, just to explain it to them. And then got a little frustrated because the website I would go to with all of the links on what that peptide does, they were not, that website wasn't well maintained. And so it got to be frustrating when I'm trying to get information. So I thought somebody has to put this book, all of this research from all over the world about the GHK copper peptide. Somebody has to put it together and then tell people how they can get those. And that's basically what the book is. All of the actions of the GHK copper peptide in the body.
Wow. So when you became aware of the significance that that element plays in our bodies, where did you find time and what was it that attracted you to the organization that we're part of now that's promoting technology that plays a significant role in copper peptides?
I had a huge life-changing experience myself with elevating my own GHK in my body, and something I didn't even know I had at first, which was a right bundle branch block. I had some funny things going on in my heart, and I had a knee replacement surgery coming up because I was suffering the long-term effects of breaking my leg and tearing my cartilage in 1973. And it was seriously bone on bone and actually slightly deformed, kind of bowed because of the collapse on the cartilage on the medial side of my knee, the inside. So because that collapsed, then it angled like this. So, but I had these funny things going on in my heart. So I had a stress echo done, and I'm really grateful now that I did, because I didn't even know I had it. And my first thought was, looking back, was so naive and short-sighted when I found out I had a right bundle branch block, and I thought, well, I've been elevating my copper peptide. Why didn't my body handle and take care of business and get rid of that right bundle branch block in 4.5 months? So fast forward a year and a half, and I had another stress echo done, and it says right bundle branch block no longer present. And I thought about the significance of documenting that I had it, documenting that it went away. And then I thought, what if I never even had those tests? I could have had a right bundle branch block and not known about it. It would have gone away, and I didn't know about it. I didn't know about either one, that I had it or that it went away. But the fact that it went away, and can I say it's from specifically from that? Not 100%. I cannot. I have to be objective about that. But two cardiologists have said they've never seen one go away. So it's more likely than not that it was something that I did, and that was elevating my GHK copper peptide. So that made such an impact on me that I I wanted to really spread the good news and get all of that information into one place. So after going through and preparing these different PowerPoint presentations over the 3.5 years, that's where I initially gained all of that information about the research. There was more. I was astounded when I dug in really deep how much that affects every different organ system in our body, and how important it is for everything from new capillary growth into muscle that you're building because of the deprivation of oxygen through your workouts, signals your brain, hey, you got to get more circulation in there. You're deprived of oxygen. So it's the GHK copper peptide that acts like the Pied Piper. Come on, fellas, growing the capillaries into that new muscle so that you can get oxygen as you build muscle. So there is some preliminary data that shows that it actually helps build some muscle mass. They need more studies, and it's not 100%, but that's what it looks like right now. From that to regenerating neurons and synapses in the brain and everything in between. So that was one of the big takeaways when I first started digging deeper into this research.
Now, it had to be that compelling for you to even want to get involved in an organization like we've got right now to help promote this for, a man in a profession in the professions that you're involved in. There has to be a compelling reason behind that. And, I'm going to make an assumption that you're an extremely caring and giving person simply because of the nature of work that you're involved in and how that benefits so many people, right? But to take on another project in order to be able to promote this, for people who are listening to this who may have professionals in their lives that are either treating them or relatives or close friends and things like that, how would you suggest that the listener here broach this subject with the medical community?
Yeah, and there are doctors who are simply focused on helping their patients. And, myself, I have to, my healthcare heart, if somebody comes up, and this happens all the time because I've been in practice 33 years, somebody will come up to me at the store or somewhere else and they'll say, you know what, I just wanted to tell you, when I came to you back in 2015, you really helped me. And I just wanted to tell you how much my life has changed. I get 2 weeks of endorphins from that, and I'm just flying high. And pretty much most healthcare providers are like that. We just want to help people. And we're faced at this juncture in our history with so many side effects of drugs, and people, they're taking so many supplements as an alternative to the drugs. But some people, when you get a really low GHK copper peptide, some of those pathways that those supplements even need to work on can't work without this GHK copper peptide. Chiropractors adjusting patients, the ability of the ligament structure to hold those bones in alignment depends on how strong and robust the collagen is around those joints. The ligaments are made of collagen. And so is it in their best interest to help them hold their adjustments longer, get more referrals because you get them better faster, and things start to progress rather than, in my practice, I would have people come into me and they say, I've been going to so-and-so 3 times a week for 6 months. And I said, well, how's it working for you? Well, I'm here in your office. I'm here. And I would say, well, I'm not that person. I approach things a little bit differently. So my approach was I want to do things, get people better faster, as fast as we can, and then I get more referrals. And that's pretty much how it played out. So in the chiropractic side of things, there are functional medicine docs, there are medical doctors who, and there are acupuncturists, and there are massage therapists who all use these products as application in everybody's practice. You can introduce them. What really gets someone's attention is to get them get their attention by placing one of the patches, either for inflammation or pain, right on the pain spot. Here's an example. I had someone in my office this morning. She had terrible headaches for many days, and she's tried everything. She came into my office, and within less than 5 minutes, she had zero pain. I said, rate your pain now. And it started at 5, 4 or 5, previously an 8, and then it went to 0. And it's like, so if a healthcare practitioner stays focused on helping their patients, it's easy to bring this into any kind of a practice, because there are so many applications for people, whatever problem they have going on. We don't, and I'm not your doctor. I'm a doctor, but I'm not your doctor or anybody else who's going to be listening to this. So I'm not diagnosing or treating or curing diseases, recommending protocols. We're just helping the body take care of business on its own. And that's how I look at it. And that's a much better model than having to depend on a drug or some other support. And those all have to go through digestion and absorption. If people have gut issues, those don't work that great. They might have some hiccups in those pathways of those drugs or supplements working.
Well, if we can dial it back just a bit, because you said something that really caught my attention when you talked about the ligaments and structures like that, that were
Sure.
made up of collagen. And, I hear collagen, and it's typically in regards to some of the women in my life talking about it diminishing wrinkles and playing a significant role in skin and the skin's
Right.
look and things like that. How many robust gym rats are there in the male segment that would poo-poo all over collagen, not knowing that the ligaments that they're working so hard at building muscle with in gyms is also made up of collagen?
That's exactly right. And to that point, some really important things about how the GHK copper peptide affects athletic performance. Should we go into that in a couple of minutes?
Yes, please.
Okay. So in working out, it's all about having enough energy to work out and recovery. So you go and you beat the heck out of your body in the gym. You're not building muscle then. You're building muscle when you're outside of the gym, when you're in your recovery phase. So he who can have more energy will have longer and more intense workouts. And he who can recover faster can get back in the gym faster. So the GHK copper peptide plays a very important role in the mitochondria and the production of ATP, which is energy. So if you can make more gas, so to speak, you can fill up your tank faster and not get fatigued and do those extra reps, those extra sets, and have all the energy you need. Now you have a more productive workout. I'll never forget, I was a news watcher when I was in junior high. From junior high on, I was always watching the news, trying to learn new stuff. And the first time I heard people talk about that you're actually, workouts are really, really hard on your body. I didn't know what they called it then, but looking back, it was oxidative stress. It causes oxidative stress. Well, it's because you're tearing down stuff. And then your body responds, and part of it is by the deprivation of oxygen to your muscles when you're working out, and that's why you get that burn and cramping feeling. Well, that signals your body to get GHK in there and chemo attract new capillary growth into those muscles. Then on the other side, you are actually the same pathway you have. You need more collagen. Well, the GHK copper peptide gives you rapid collagen repair. Rapid collagen repair, lots of vascularization. You got those big bulgy veins and arteries, and you have those big bulgy muscles. They're all made of collagen. So this is the key in this workout. Now on the recovery side, people who use the GHK copper peptide are going to find they don't get those muscles that are so sore, or ligament because of the stress, that they're so sore that they can barely move and get back into the gym. If you can recover that faster, you have better, stronger, faster, longer workouts because you have more energy, and then you have faster recovery time. So now you're back in the gym. It's not the guy who is 2 minutes faster or even 5 seconds faster running the 100-yard dash. It's the guy who's 1/100th of a second faster.
Yeah.
So this is the edge that people, athletes can look at without having a performance-enhancing drug. Because after all, they were judged by the world and U.S. doping agencies as not doping because nothing goes from the patch into the body.
I know, like it's so phenomenal when you begin to dig into this and you begin to realize that there are answers out there and options for people who are so lost on this front and who rely on, and I don't want to pick on the medical community. I know they do a great job, but it's becoming more and more apparent, especially with the stress loads and the anxiety and depression that people are dealing with in regards to what's unfolded with us as a human race over the last couple of years. People like are masking the symptoms that they're experiencing and not really dealing with them, I don't think, appropriately. And the more people who are equipped with the knowledge that you have, the heartbeat that you have, to want to spread this message out to a world who needs it so badly right now, we all get to win that way. Like we really do. We really do. Timing is perfect for this. Like it really is. So if you had any words of encouragement for anybody who may be listening to this from part of our community who want to share it with the professionals or simply with their spheres of influence, what would you share with people to have them maybe look at this with a little bit more of an open mind?
Well, first of all, I would like to tell people you don't have to be a doctor to these, and because you're not prescribing anything, you're sharing with a friend something that can help them be the best they can be. You don't have to go out and be a salesperson or anything like that. First of all, everything is sales. Someone ever doubts that everything is sales, how did you convince your spouse to marry you?
Good one.
Yeah, well, it's just sharing from your heart, finding, talking to people, asking questions. How are things going? How did you guys make it through all this stuff, whatever's going on, and find out what's going on with them, and say, I heard about, whatever your verbiage is. I heard about something that could possibly help your body take care of that, and share a link to a video. I mean, that's it. Don't try to explain it. The video explains things a lot better than I can, and that's what I do too. I just share a link to a video, and if enough people see that, some of them are going to want to give these products a try. And one of the key things when you're introducing them to people that you need to remember, when people say, I'll try this for a month, 2 months, 3 months, whatever they say, then you ask them, okay, That's great. Tell me what you're going to be measuring.
Big question.
If you don't measure it, you don't know. And for example, people would come into my chiropractic practice, and I would always tell them, now a couple of weeks down the road, when this goes away, you're going to forget about where you are. So let's rate it. Let's rate it now, because pain gone is pain forgotten. Dysfunction gone is dysfunction forgotten, because you don't have it anymore. How do you describe something you don't even have? And so ask them what they're documenting, what are they measuring, and then point out some things. You're probably not going to notice things like bone density, like liver function changes, like kidney filtration changes. The thing that you might notice the most, that most people experience, are, an increase in your mood, your upbeat mood, better sleep, better cognitive function, decrease in pain. Those things are pretty easy to see, but I want to tell you, like Dr. Harmon said, I would not have known I had a right bundle branch block, and I would not have known that it went away had I not documented it. So what are you measuring? That's very important to establish when someone starts using this.
So cool. I love that. And I'm right from that train of thought, right? Like not taking this out. Well, one of the things that I share openly, and I'll be talking about on the next call, is that I don't have an opportunity for anybody. What I do have is an option for everybody.
I like
Because the option is about them. And I can't find out about them if I'm coming at them with something I'm excited about. So I love the fact that you're coaching people and talking to people about asking questions and finding out, where are you hurting? What are some of the things? And then when they do make a decision to try this, if we can use that term, because that's typically what it is. Okay, I'll try it for uh, to then just really be asking the questions in regards to, yes, well, what are you going to measure? Now, I've got a question on that front. Maybe you can answer it, and maybe you can't, because I have somebody that I'm talking to at this very point in time who was asking me, well, how will I know this is working? And I said, well, there are a couple of things you could do. Speak to your family doctor and have like a blood panel done, and get some good sound readings, and then get onto this protocol. And then in 3 months, you can go and get more blood work done, or get what you need to get done, so that you can compare the results. Because I'm sure that you'll experience something on those fronts within a 3 month time frame. And the response I got was, well, I don't have a family doctor. Where would I go to have work like that done?
Well, and also, like me, if I went and had my blood work done, I don't have anything wrong with my blood work. They're all within normal range. So if I don't have any issues that I'm monitoring, that might not be very helpful, because if your work, if your levels are within normal limits, you don't have anything that changed because it stayed in normal limits. The GHK is not going to make your blood go weird. So, and that's part of the conundrum when somebody says, how will I know they're working? I go back to that right bundle branch block. Didn't know I had it. It went away after I found out I had it. And so what else? What else? You might look at it like, what have I prevented by keeping my body healthy? What have I prevented by keeping, all of those levels in a normal range? Because we age, that's when they tend to start, getting out of range. And the funny thing is, a lot of times you don't know they're out of range, and then you go have some blood work done. So it might not be as helpful as one would think, unless there is something that's out of kilter. And so sometimes it's a spouse that tells them, or a friend they haven't seen in a long time, and say, wow, what have you been doing? Because the changes occur so slowly. For example, again, I had a conversation with a guy who cuts hair next to my barber, and I've been going to this guy for a long time. And he and I used to talk. He didn't used to be as busy, but he's been really busy for over 2 years. So we hadn't spoken, and he wasn't busy. This about 4 months ago, 3 or 4 months ago. And I stopped to talk with him. And after a few minutes, he looked at me and he said, "I don't fall asleep anymore." And I went, "Oh my gosh, I used to fall asleep every single time I got my hair cut." My barber was going, "Hey, wake up, wake up," because I was just tired. And he noticed that. "You don't fall asleep anymore." I didn't realize what had happened. He told me, the barber next to my barber told me and reminded me of something. So it's not always easy when you're looking at subjective complaints. And that's why when you go to the doctor, they don't just ask you what your complaints are, they do tests. So you have subjective, you have objective findings, whether that's a lab or that's watching somebody limp, or what are my objective findings. You don't have to be a doctor to do it, but just so you know, there are more measurements or metrics that are used to assess what changes are. So yes, it's always good when you have someone who's a one patch wonder, like they use it and this miracle happened. You look at them like, "You're telling me about a dream you had, because that couldn't possibly have happened in 24 hours." And so that's always, it's always cool, but not everybody's like that. I wasn't. But I just tell people, don't quit before the miracle happens, because you don't know when it's going to happen.
Oh, wow. I love that line. I love that. Well, just so you know, I'm promoting your book to everybody. I know our team is promoting this book to everybody who is within earshot, because
I
I
appreciate
really,
that.
I really do believe um, mankind should know about the information that's in this book, because it will serve everybody, and it will serve them greatly if they pick this up and they take it to heart and they begin to really implement, just some of the wisdom that's in this book. So I on behalf of the team that I'm part of here, and I just want to thank you for taking time to show up here with me today and share your incredible knowledge and that soft heart that lives in your chest, man. Like, thank you very, very much.
Thank you, Don. I appreciate that. That means a lot to me. There's those 2 weeks of endorphins.
I love it. Okay, everybody. Dr. Jon Harmon and myself signing off right now. Any parting words for the crew?
Oh, it was a lot of fun. Thanks for having me.
Thank you so much.